I talked in my previous interview about becoming passionate about person-centred approaches. I remember two events in particular that inspired me and sowed the early seeds for Whose Shoes. I remember listening to Caroline Tomlinson, an inspirational woman, talking about her son Joe, who had complex learning disabilities after contracting meningitis as a 6-month-old baby. She talked about their experiences in service land, where things are done to you rather than with you, and the ridiculous number of carers that they had coming in and out of their house. What a difference personal budgets have made, giving Joe and the family choice and control so that they were able to recruit the carers themselves, choosing individuals who would truly understand Joe's needs, not just for personal care and support, but to have a good quality of life. I remember making myself unpopular with some of our senior management team by standing up and saying, "This is brilliant, but how does this work if you don't have a Caroline?" The second pivotal experience was a big conference that I attended. Most of the speakers were men in suits, social care leaders far removed from the day-to-day practicalities of running a care home. I was privileged to be sitting with a group of care home managers and staff. One speaker, who was highly respected in my world, suddenly came across very differently, seen through the eyes of people at the coalface. They were no doubt thinking about their work and the practicalities of running their care homes, and what this newfangled personalisation agenda might actually mean to the day-to-day lives of staff, residents and family carers.
Safe. So safe. Safe in my chair, I sit and stare. They only seem to care if I move. Walking around, I might fall to the ground, so I sit in the same old groove. And I watch TV, obediently. But what if the TV blows up?
That's a poem I've written since as part of my Whose Shoes work, but it seemed to fit in well here and hopefully wake you up if you're getting a bit tired of hearing one voice. My work is all about bringing all the voices into the room. It became clear to me that nobody really knew what personalisation was, but that the powers that be didn't seem to realise this, or at least were certainly not prepared to acknowledge it. It was as though if they said it a bit louder, this new agenda would magically happen and they'd be hailed as innovative leaders. Huge potential to improve people's lives, certainly, but it felt as if the real answers were in the audience rather than on the speaker platform. There was a need to tease out how this could all work best for everybody, spotting gaps, spotting inconsistencies, hypocrisy possibly. Everyone seemed to be looking at the issue from a single viewpoint without taking in the whole situation and all the people affected. And arguably the most important viewpoint of all, service users, as people were often referred to in the early days of personalisation. I prefer to talk about, and indeed champion, people with lived experience, the people who genuinely know clearly what needs to change, but do not always have a voice. My Whose Shoes mindset was growing. There were tensions and incompatibilities everywhere. Everyone must have choice and control, but we were in a completely risk-averse society. How does that one play out? Similarly, we need to focus on prevention, yet the thresholds and eligibility criteria for someone getting help in social care were going through the roof. It seemed as if the person needed to be almost dead before they got any help at all, a far cry from supporting people in the community and helping them to stay well and avoid the need for services in the first place. There were at least 6 big tensions such as this, so I started to get the idea of juxtaposing them, throwing them together within one big melting pot, getting people from all the different backgrounds and perspectives, discussing them and seeing what would come out the other side. Challenging attitudes and assumptions, reducing stigma, and encouraging a more holistic approach rather than just seeing people as a health condition. I didn't realise how big my vision was, and this has become apparent really as Whose Shoes has grown and developed. Basically, the bigger the challenge and the more different perspectives there are, the more it's necessary to bring everyone together and try and work out sustainable quality improvements that achieve the desired outcome. This is becoming even more evident now and pressing as we work through the learning from COVID-19 and realise just how interdependent we all are. And I've just had a nice thought. I can see that things have come full circle in a way, and I'm now able to give something back in terms of that early light bulb moment that I got from Caroline Tomlinson all those years ago. You remember, Joe's mum. I'm working on a charitable basis with parents of children who have Down syndrome. We've co-produced scenarios around screening and diagnosis of Down syndrome to help healthcare professionals understand the importance of accurate information and to think about their language and communication. This has involved running workshops, educating staff in maternity units, but also at the Royal College of Obstetricians and Gynecologists. A board game, it seems, can be influential. I first created Whose Shoes in 2008, and it's essentially the same tool as it's always been. A board game with crowdsourced scenarios and poems to get people coming together as equals to talk about and better understand the issues and to seek to co-produce realistic solutions. The resources themselves vary according to the subject being discussed, and we now cover a wide range of topics, but mainly around some aspect of health and well-being. Sessions are highly interactive and inclusive. Participants enjoy in-depth discussions in a relaxed, non-threatening environment, and typically these are recorded live by our wonderful graphic artists, providing a lasting record and acting as a driver to keep the conversations alive and follow up the improvement ideas. This is a clip from our maternity workshop in Brighton. As you can see, we have quite a lot of fun as well as getting serious work done.
Other babies are choosing to go down.
And that's where the teamwork comes in.
Speak up when I think positive change can be made.
The sessions are thought-provoking and free-flowing, challenging but fun. People quickly identify and discuss the topics that are important to them. Person-centred holistic approaches are embedded in the tools. Healthcare professionals can be inspired to change their practice in many ways, rethinking how they engage with others, specifically patients and their families. Clinicians often say that their training is too focused on medical learning, and they benefit hugely from this more rounded approach. The scenarios are colour-coded and represent the views and experiences of different groups. Blue scenarios are the patients or people themselves, their family and informal networks. Yellow cards give the views of frontline staff. For example, it could be a senior consultant or a receptionist, a porter or a cleaner or a midwife, an occupational therapist or a critical care nurse. Red represents people with formal power, whether they are policymakers or perhaps the chief exec of the organisation. And green cards are generally others who have an involvement or interest in the subject area, for example volunteers, people developing digital solutions, anybody really. There needs to be real clarity about the outcomes that a project or organisation are trying to achieve, for example, improve patient safety. Our bigger projects involve considerable preparation time in teasing through the key issues and working out the best way to bring the right people on board and trigger the necessary actions for service improvement. It is very values-led. I saw clearly that major change was only going to become a reality if the process was authentic, if people felt that their concerns were listened to, if tensions between competing policies and drivers were recognised and explored, not swept under the carpet or put into the too difficult box. A lot of it has been around creating the right conditions for people to be able to speak openly and honestly. We aim to keep things simple and jargon-free, to enable people to empathise with others and work together, to try more creative approaches, to be confident, to cut through the stuff and feel that they can make a difference without waiting to ask for permission. People and what matters to them are at the centre of everything. Some scenarios are controversial and hard-hitting, hopefully provoking what we call lemon light bulb moments, as people suddenly realise the impact of the words they use, the way culture works within organisations, and the need for positive change. And the poems seem to be particularly powerful, often resonating with people in a deeply personal way. It's brilliant to get new people writing poems and discovering their creativity. Claire Cox from the Patient Safety Learning Hub is just realising that she's very good at this.